Clark County recently received national media attention that a health official hopes to never see. A measles outbreak that began on January 4 put Clark County in the spotlight. The measles virus is highly contagious and can cause serious complications for some, including young children and unvaccinated pregnant women.
Measles is a mandatory reporting disease, so if anybody has a suspect case or any positive lab results, they're required by law to tell us, the public health department.
Part of Clark County Public Health's mission is to prevent disease and respond to emergencies. On January 15, when the investigation into measles cases grew too large for the Communicable Disease Program, Public Health activated the Incident Command System, or ICS.
It's a very organized structure, but what's so nice about it is that everybody knows what their roles and responsibilities are, and that structure is divided into functions. For example, as an incident commander, my function is to set the objectives for this particular response and make sure that we are able to meet the needs, and in this case, as pretty much every case in public health, is we want to stop the spread of the disease.
Trained public health staff were pulled from various programs to work in ICS. To ensure adequate resources for the measles investigation, Clark County declared a public health emergency on January 18. This enabled health partners from Washington and Idaho to more quickly come help in the response.
So there's 4 functions. So you have operations, which is basically the doers. You have planning, which is basically the people that are keeping us on task, projecting forward, keep giving us situational awareness. You have logistics, which are the getters that get stuff to support who's ever in operations so they can meet the mission. And then you have finance, which of course is pretty much finance.
Incident Command was stationed at the county's Center for Community Health building and was active 7 days a week, 12 hours a day until March 18. Public Health has activated ICS before, such as for H1N1 in 2009.
Logistics basically means making sure resources are available that are outside and making sure that all of the communication within the building are here and working, making sure a computer is hooked up properly. We have internet access. We are able to print. They are able to access specific programs that we need for the incident.
Operations' role in the measles response was similar to that of detectives. They tracked down cases, locations, and contacts. In order to protect patient privacy, conference meeting room windows were covered with paper.
We have the patients. We call to say, were you there? Was anybody with you when you were there? We get more information about who was actually exposed at that time. Then we determine their level of immunity. So if they have proof of immunity or we're able to determine it some other means, we put them on passive monitoring.
The measles virus can linger in a room up to 2 hours after an infected person leaves. At the height of the measles outbreak, operations staff had more than 200 people on daily monitoring.
Then we have our active monitoring calls, which is calling them every day. We ask them, are they symptomatic? Do you have a fever? Do you have a rash? Do you have any of the symptoms of measles? We ask them to exclude themselves from 7 days until 21 days after the exposure, which it's a lot of missed work and a lot of missed school.
On March 6, the U.S. Surgeon General Dr. Jerome Adams visited Clark County Public Health and received a briefing on the measles outbreak. In his message, he focused on the importance of accurate conversations with parents about vaccinations.
Vaccinate, vaccinate, vaccinate. That's the #1 thing. This is a preventable disease, and we have spent a lot of money, and I think people forget how many resources are being pulled from all over to respond to this. And more importantly, we have people that are sick that don't need to be sick, and it's very simple to just vaccinate.
To date, the state and county have spent more than $1 million on the measles outbreak. During this time, other Clark County Public Health services were impacted, such as delays to septic system plan reviews and the Nurse Family Partnership Program.
I go out and I do routine inspections with restaurants or any kind of food establishment. Normally we try to get in about 10 to 12 inspections a week. And we were not able to do that due to this outbreak. Anytime establishment is planning on opening, we have to do a full review to make sure that their plan is food safe. We've been behind on that, unfortunately. And that puts a damper on everybody else's time frame.
So far, Public Health has identified 73 confirmed measles cases, and the investigation continues. For more information on the measles outbreak, visit Clark County Public Health's webpage at clark.wa.gov/publichealth/measles investigation.